was when he took over.
And that's why I feel comfortable that the decision not to renew, although it is very personal, would have left the facility in a better state than it was 2 years ago. So that whoever comes on with good leadership and being able to rally a senior leadership team around a particular set of values and strategic directions, I think the complex can move towards greater improvements in care to the public.
For the DBS News World, I am Zane Romulus.
Thank you very much, Zane, for this report. It was filed this evening during the DBS News World. My guest is a medical doctor, and her name is Dr. Sylvia Wilson. Welcome to the broadcast.
Thank you, Timothy, and good night, fellow St. Lucians, and good night to my colleagues, doctors, nurses, and also firemen, the police officers who work to take care of our patients. So a special good night to them.
What is it like being a medical doctor in the public health sector in St. Lucia? What's it like right now?
Timothy, I joined the profession. Well, I joined the medical services in St. Lucia in 1990. Mm-hmm. After graduating at the University of Havana, I did a year at Spanish Town Hospital in Jamaica, and then I decided to come home. And officially I started in 1990, and I have worked I worked with Dr. Chase, Dr. Marius, Dr. St. Rose, PW St. Rose at the time, in maternity department, and a group of wonderful midwives, Sister Senqua, Sister Charlemagne, Sister Paul. And at that particular time, we could have said that we had a maternity department that was really running efficiently. Although, the building, Victoria Hospital, is a very old building, but the management of the departments and the sisters, the ward sisters at that time, were very, very good.
But I think that really is what really makes a difference in terms of
it makes a very
assisting people in terms of ensuring that they convalesce, in a very speedy manner.
That's one of the factors. So after maternity, I went, did some of my work, internal medicine at the time, Dr. Didier and Dr. Derek King. And then I went into the emergency room, and my passion was emergency medicine.
But what I want to get on is, what is the experience like right now? Because you say you started in 1990. So what is the experience right now? Because you have 34 years now to analyze, to contrast, to compare.
It's a lot of sacrifice. I think presently a lot of the doctors are looking for better conditions, resources to work with, better salaries. So I think it's a bit frustrating for some of our colleagues. And as you can see, some of our colleagues have definitely resigned.
So if it's frustrating for medical practitioners, what do you think
for the patients,
what the patients are going through, those who are suffering and who are seeking medical care, and the conditions in which they are receiving it right now in St. Lucia?
Timothy, there are a number of factors. And for the patients, every day, I have patients calling me and complaining about something. That yesterday, I had a patient, a police officer, his wife, had to do a cesarean section at the OKEU hospital. And, the process and all of that was frustrating to him. We had to get to that. So there there are situations all the time patients are being faced with problems. And just to mention, presently one of our families in the Miku area is going through grief for the death of her husband, Mr. Special Constable George from Monrepo, who died at St. Jude's Hospital. And I would like to extend my condolences to the family there in Monrepo. Also,
before you move on, you say it's a special constable. The circumstances, would you be aware of the circumstances? No,
I don't want to, because at that particular time, I got to respect the
privacy,
the privacy of the family. But of course, he is dead. And also a family in Bar St. Joseph, Mr. Deboville, who was a patient of mine and who died at Victoria Hospital like 2 days ago. So these two families, I would like to extend my condolences. But we have families that are going through a lot of pain, a lot of grief, because of the unavailability of the services that we need in St. Lucia.
Why do you think the problem has deteriorated to such an extent that it seems that there is this cry that is taking place in unison, not only involving patients, because several years ago we normally hear the patients complaining, but now it is the medical practitioners who are at the end of their tether. They really cannot continue to operate in such circumstances. It really says something about the state of healthcare in St. Lucia right now.
Timothy, listen, we are a developing state, all right? We're not like Singapore or Japan or Israel or Europe.
But Barbados is a developing state as well.
Exactly.
Yeah.
Yes, but then government finances and ensures that they have a system that people are comfortable with. But we have seen from 2009, we do not have St. Jude's. We continue to operate in the stadium. Okay? And the nurses and the doctors and everybody there, I can tell you, I can call them heroes. 2016, I throw in the towel. I couldn't take it anymore because of what we call stadium fatigue.
But you want to call them as heroes?
No, because
hold on. But can we also call them accomplices because for having tolerated this for so long?
Yes, well, maybe some will say that. But then, when you're faced with patients, for example, a gunshot wound, and parents, relatives screaming, crying, and you as the medical professional got to do something to save a life, you have to do it in whatever circumstances that you have available. Okay, so sometimes you may not have everything available, but you have to try your best. And that's what we did at Victoria Hospital for many years. We invented things, we did so many things so that we could at least save the lives of patients.
So therefore, Dr. Wilson, would you agree that inadvertently, not deliberately, through no fault of yours and the medical practitioners in St. Lucia, you are complicit in allowing this problem to deteriorate over the last few years because of the accommodating stance that you all took? In hindsight, isn't it?
Timothy, the Medical and Dental Association, okay, have been complaining
quietly.
Yes, to various boards. All right, to medical directors, to Ministry of Health, all right, quietly. But it continues to deteriorate, and the budget for health continues to be cut. Okay, the last budget, by how many millions of dollars the budget was cut. And then you have the hospital always in debt. So how do you get the resources? How do you get the medication? How do you get your equipment working? How do you get your equipment the best of technology? How do you get the manpower? How do you get the emergency drugs? How do you get all of these kinds of things if government continue to cut the budget of health?
But what can you do? Not demand it?
Well, you can demand it, but are they listening? Would government listen? All right. So let's try to put that in perspective. All right. You have a right now you have a board of the OKU hospital. The board would listen to whatever concerns of the clinical staff. All right. But the concerns and the budget must go to government, or government would give them a particular budget to work with. But is that sufficient? Also, how are we financing healthcare in this country? Is it sufficient? Are we meeting the needs of the hospital? Now, not only the hospital, but we have health centers. How many of our health centers are closed? Look at the Castries Basin. The Castries Health Center services Marsha, Mondida, Rosehill, Odlum City, Pave, Castries, Fuller Show, Hospital Road, all of these areas, all right? So you have a very wide area being serviced by the Castries Health Center. Presently, it is closed for whatever reasons. At one time, we had the Marshall Health Center. It has been closed for years. So you have the elderly and even people within the Castries Basin and outside who would want to service or would want the services of Castries Health Center, but they have to go to Laclery, which is a very small health center. And right now, Laclery is having their own problems. So the last time some patient told me, Doc, you know where they have to send us? Some elderly people, they were talking to me, they were seated on the square. They said, they told us to go to Bexon. So how can you send elderly people all the way to Bexon and Cicero? Okay. Second, you have Victoria Hospital, which is closed. Yes, you have a few patients there for the overflow from the main hospital, but you do not have an accident and emergency department at Victoria Hospital anymore to service the public. So it is closed. And of course, Ministry of Health said that they would have done what is called an urban polyclinic, all right, in the Castries Basin. So now you find when patients cannot be accommodated, or some patients cannot or feel that they have to wait for hours at the emergency room of the main hospital, they go all the way to the polyclinic. Now, ask the staff of the polyclinic, of Grosile Polyclinic, the number of patients they see per day, and all kinds of cases. So the Grosile Polyclinic opens from 8 to midnight. And you have patients coming from not only the Grosile area, which is Cap Estate, Rodney Bay, Grand Riviere, Marisil, Bois d'Orange, and also Castries and Babuno, Moshi, coming to the skeleton staff that we have at the polyclinic. And of course, these people are exhausted too. So when you have a problem with the services in the center of Castries, the people will go to the main hospital or the polyclinic. And after midnight, everybody has to go to the main hospital. So what about the services? So what about the services in Castries, in the center of Castries? So I don't know what plans the Ministry of Health has, but as they said, they wanted an urban polyclinic, and that has not been forthcoming. So, Timothy, our people are suffering, and they are demanding that they need better services, healthcare.
Who are the people who are suffering and demanding better health care?
Our St. Lucians.
You get that impression?
I get that impression. No, but Timothy, people call you all the time about what the problems that they're having.
I don't get that impression that is happening en masse. A few people calling Newspin and complaining about the state of the health care. I don't think some people tell you that even that's a barometer that could measure the level of discontent with regard to the state of the health sector in St. Lucia. Because according to you, people are suffering. But don't you think maybe they are suffering quietly, in silence?
Well, Timothy, if the Medical and Dental Association has written to the board, and I'm sure that's not the first time, okay? And doctors are leaving because they do not want to be sued. They're tired of working with minimum resources, and the patients look to them for better care, and they cannot deliver it. And people would protect themselves and their profession, and that is sometimes the only other choice they have is to leave. So our Prime Minister says it happens all the time. But let me state to you, if the head of surgery leaves, you need to have an immediate replacement. When I say immediate replacement, because for surgery, you have ectopic pregnancies, you have acute appendicitis, you have motor vehicular accidents, you have gallstones, you have accidents, abdominal injuries, head injuries, you have occurring all the time. So you must have a surgeon on call, and you have accidents would happen all the time. Not only motor vehicular accidents, but the violence that we have, which is not only gunshots, but domestic violence, stabbings, all of these kinds of things. You need a surgeon, and not one surgeon, because that surgeon would need rest, and you need to have at least 3 surgeons. I mean main surgeons to handle the surgical department. Now, if you have people leaving, you have to replace these people immediately, because you never know when a stab wound would come from the Dennery area, or come from the Grosile area, or come from Castries area, and you have to deal with that particular case immediately. So these cases are not something that is planned. Emergencies and surgical emergencies is immediate. And that is why not only do you have to have a surgeon to do the rounds but on call, you must have a surgeon on call, or you must have a surgical team on call. So when you have a surgeon on call, you also have junior doctors with the surgeon. So what we call a registrar, which is like a deputy head surgeon, and also senior house registrar, a senior house officer, and junior house officers. So you have to have a team on call. So that is not, that is ludicrous to say that it is not important, because you have emergencies all the time. All right? So That's for surgery. Obstetrics and gynecology. What is the meaning of that? That an obstetrician is, or head of obstetrics is not there. It means that if you have to have cesarean section, immediate cesarean section, you need somebody there. All right. For example, a patient who is pregnant complicates. All right. For let us say that the cord is around the baby's neck. You have to do an aspirates. You have to do an immediate cesarean section. All right, a delay in contractions. Then various reasons why you have to do a cesarean section. And sometimes, even with pregnant women, you have to go immediately into the operating room. So there is no timetable to say that you can say that you can plan, but that is why you must have an obstetrician on call, and you must have obstetricians in the hospital. That is to not only to save the lives of the pregnant mothers, but also the babies that are supposed to be delivered in a timely manner, and of course healthy. So that is important. If you have an internist resigning, an internist takes care of heart attacks, strokes, blood clots, okay, pulmonary embolism, all of these kinds of things. These people have heart problems, okay. So how can you say that you do not need these people? You need them. Any society would need them. So when you have people who are qualified in emergency medicine, in internal medicine, in obstetrics and gynecology, in nephrology, people who are on dialysis, okay, and surgery, I mean, what, are you preparing people for Cricks and Rambali? That is very serious. It is very, very, very serious. And any normal society would know that is very serious. Anybody can get a heart attack. Anybody can need surgery immediately. Anybody can be involved in a motor vehicle accident. And you don't need a surgeon in the hospital to see the patients on there. But you also need them on call. So that is very, very serious. So we cannot take health care lightly, and we cannot say that that happens all the time. It is a serious issue. Okay, so Timothy, I don't know if we can replace these people right away, but that is a very serious issue to run a hospital.
So you're saying that the government, the Ministry of Health, would probably have to seek those personnel from overseas?
Of course.
Do you get a sense that there is an urgency to deal with the problems that you have just referenced?
Well, Timothy, I don't think so, because I do not know if most of these people have been replaced immediately. Okay? Because, as I said, you need to have a surgeon on call. Apart from a surgeon being in the hospital, but surgeons must be on call. And why do you need that? For exactly the reasons of anybody can get an appendicitis. Anybody would need a stab wound, chest injury, a motor vehicle accident. You need a surgeon to go in immediately. All right? So that is not, that is not a bank. All right? It is a hospital where you deal with lives. So there should be an urgency to deal with that situation. So I think Ministry of Health and the government of St. Lucia should consider that an immediately. So
what is the role of the St. Lucia Medical and Dental Association in all this? What do you think the approach should be in terms of advocacy? Yes, the letter was written to the authorities in June of this year. You're a member of the association.
Yes, I am.
What is kind of discussion are you all having with regard to the way forward?
Timothy, if you are a doctor, your objective should always be caring for people. All right? Caring for people's lives. And you make the sacrifice to your family, because most doctors, they're in the hospital, they care for the patients, they don't sleep for, I don't know when last I slept for 8 hours completely, for many years. All right? I think I've been now programmed to sleep for just 4 hours. Okay? So the sacrifice is to ensure that the lives of your patients are taken care of, the illnesses that they have should be dealt with, or in other words, to take care of human beings. All right? So when you when you have to take that time to do that, it takes a lot. And any doctor would be concerned about the quality of care that you give your patient. It is not your responsibility to provide resources in the hospital, or to provide medication in the hospital, or to provide suture sets in the hospital, or to provide the nurses and the x-rays and the labs and all of that. You expect that to be part of the hospital, because your work is to care for the patients, and you're supposed to have the support services. So when, for example, if I work in the emergency room, I see a patient with which I think may be a heart attack, I'm expected to have an EKG. I'm expected to have the lab services to give me the results immediately. I'm expected to get the drugs to deal with the patient's situation so that they don't get complications. And I'm expected to get a bed. I'm expected to get the nurses to care for the patient, and expected to stabilize the patient. All right? That is what I expect. But it is not my responsibility to be running, looking for whether the lab is working, whether we have reagents, whether we have a lab technician, whether we have any lab available, or we cannot do the labs necessary to diagnose the patient, whether we have EKG machines. And these are the things that the doctors and the nurses find themselves doing, having to find out whether we have an EKG to do the EKG for somebody who has a heart attack. All right, a basic thing. Whether we have the labs to stabilize the patient, whether we have the personnel to deal with that thing. So we should not be placed in a position where we have to be looking for that kind of thing. So when you work as a physician, this should be readily available. It's just like the surgeon. If you go into the operating room, you should have the anesthesiologist, the nurse. You should have the equipment available. You should have the medication. You should have the resources. You should have all of the equipment so that you can perform the surgery. You cannot be in the middle of surgery and saying, oh, listen, we don't have sets. We don't have that. We don't have the other. That's ludicrous. So you cannot place that kind of responsibility on doctors. And when doctors and nurses find themselves in that position, we need to ask serious questions. All right? So a hospital, all of these should be available so that the nurses and the doctors, the lab technicians, and the various personnel can do their work efficiently. Because if I want to stabilize a patient within the 15 minutes, okay, I should have all of that available. And I should not be are looking for that and crying for that and all of these kinds of things. That should not happen. And I think what our doctors are facing on a daily basis, the lack of resources, the lack of medication, and the inability to deliver to our patients, and of course, which can also result in the doctor being sued.
Because earlier you've made reference that's one of the fears of many of the doctors who are resigning. But the Prime Minister said that they are leaving for greener pastures.
So I would like to ask the question that, are you telling me all of the doctors who have left and are St. Lucians, many of them, are they satisfied with what is happening at our hospitals or within our healthcare? No. And that is why the letter was written on behalf of the doctors, because they are not satisfied. Now, if I, as a St. Lucian, and I have gone to study for many years, I want to come back to my country so that I would be able to serve not only my immediate family, Timothy, by my parents, my grandparents, my children, my neighbors, my colleagues, my classmates, my grandparents' friends, my community. I want to be able to deliver that kind of service to them. And I feel, as somebody who may know them, I might be more emotionally attached to the fact that I can take care of them. Okay? So how many of us, how many of our doctors who are St. Lucian doctors want to serve our country? Many have done it. Many have done it. I can tell you. I mean, people like, yes, Dr. Owen King, Dr. Derek King, PAW St. Rose, who used to operate from 7 a.m. to 7 p.m., Dr. Marius, Herbert Marius, Dr. Chase, Dr. Siemens, who have retired now, Dr. Remy. That's among some of the few, okay, who have sacrificed and who have operated under all kinds of conditions to save our people. All right? And we can write books and we can continue to say stories about the efforts of these people, and even some of our nurses, you understand me, who have worked tirelessly and have retired and who have worked under all kinds of conditions. So I think the time has come that our country, we need a better healthcare service, and we need government to finance the health system.
Now, if the government is having problems in locating the requisite finances, right, to operate those health institutions in an efficient manner, what should be the option? Because there's been so much talk of having universal health care in St. Lucia, some program whereby contributions can come from either the citizens of the country are working in conjunction possibly with their employers, but come up with some kind of system. What are you suggesting? What do you think should be done? Because it seems that the governments have been at the wit's end in terms of having the capacity to finance healthcare on their own.
Timothy, my personal opinion, I think many of our governments have not, they have to bite the bullet. When I say bite the bullet, they have to do something about healthcare financing. And I remember, because when I came in, Romanus Lancico was the Minister of Health, all right? I know Mr. Lancico was very enthusiastic about healthcare and all of these kinds of things, and did a great job in the providing health centers throughout the country. And right now, many of our health centers have deteriorated. All right, and I know, I don't know for specifically, Masha Health Center is no longer in existence, and I know like Larry Shoes, because I worked one time in the Larry Shoes base in the Dennery in the Valley, and I know the Larry Shoes Health Center caters for a lot of patients. I can never forget the first time I went into Larry Shoes, and I said, well, listen, I know my clinic will finish early, and I saw some ladies setting up to sell, you know, like soft drinks and things like that. So I said, but you're not selling by the health center. So they said, Doc, ça say buy whole journée, whole journée. And truly, Timothy, I was stunned by the number of patients. I had to see over 80 patients. You understand me? In that Larry Shoes Health Center, we came from all kinds of the communities like Gardet, Poleon, Montparnasse, Grand Rivière, Grand Ravine. I think I learned Richmond. I learned all of these communities inside of there. But the number of people you had being serviced by that health center, it was so much. And of course, that health center is closed. I think it got burnt. And these people have to be seen in the Richmond Health Center. All right? So I can tell you on a daily basis the number of patients there. So the primary health care services need to be boosted up. In the Babono area, we have the Foisson, Lague, and also Babono Health Center. I think a good job has been done with the Babono area, because you have the health centers which have been upgraded, and of course and I think they have a doctor at least every day, because I think on a Monday you have in the Babono Health Center, then you have on Tuesday in Lague, and then you have Foisson and back. So that area is covered. But there are some areas in our community that only see a doctor once a week, all right? Like Saltibus, all right? In all these remote areas. So the primary health care needs to be boosted up. We need the personnel. We need to deal with all of that kind of thing, so that we do not have people migrating into the hospital, and that we can take care of a lot of the medical problems in the primary health care services before they get to hospital. So not only the secondary and tertiary services that are needed, but you need thing. And of course, Vieux-Fort, St. Jude's. We have St. Jude's being operated in the stadium for the past 15 years. For the past 15 years. So you have emergency services continuing in the stadium. You have maternity services. You have pediatric services. You have all of the services got to be done in the stadium, which are supposed to have been just emergency, maybe a year or 2 years, and that be taken care of. So St. Jude's is a whole, I think maybe you need another shoot to talk about St. Jude's. But the people of the South continue to suffer because they do not have the hospital, and it's 15 years now. It is 15 years.
So the people who are watching at this point in time, and maybe most of them who are healthy and so on, what do you say to them? What is at stake in terms of healthcare in St. Lucia? What is at stake for us in this country?
Timothy, you could be healthy and you still need healthcare services. Because you could be driving down the road and you get involved in an accident, you become unconscious, and you need the services of a surgeon, emergency, a doctor, the nurses, ICU, all of that. So it does not mean that you have to have a chronic illness for you to face a hospital. You could be perfectly normal, and you can find yourself with a medical emergency. Your children can be perfectly normal, and then there can be an accident at home. Your baby can just ingest some Clorox or something. You need to rush to the hospital. All right? And you need the services of these skilled people to deal with the emergency. So not only people who have kidney problems or hypertension or diabetes or sickle cell disease or fibroids or anything, but even a normal individual would need the healthcare services. So that is why we have accident and emergency, that anything can happen at any time. So you can take care of yourself to the best of your ability, dieting, preventing accidents, driving carefully, and so on. But you never know.
It's some things you just cannot avoid.
That is something you can never avoid, and that is necessary. It's just like you cannot avoid eating. So you need to have healthcare services. So whether you are sick or whether you're healthy, you need to have a hospital.
So let me put you on the spot. Dr. Damian Gries is scheduled to be the CEO of the MHMC, former health minister. We just had the story earlier that we played of Dr. Dexter James. His tenure ends today. What do you think of Dr. Damian Gries assuming the leadership of the Millennium Heights Medical Complex?
Well, I was at A level with Dr. Gries, all right? And of course, I know Dr. Gries as the Minister of Health, and at the time when I was working, he tried his best. But I wish Dr. Gries the best. But I know that Dr. Gries has a task. And I hope his cabinet supports him, one, with a budget that he can sustain the hospital, and secondly, to provide the quality of care that St. Lucians need. Okay? And of course, to ensure that the complaints that St. Lucians are having could be minimized. So I think Dr. Gries has his work cut out for him. And as a St. Lucian, I would wish him the best, and I hope that he can deal with the problems, or he can get the necessary support that is needed to manage the hospital. And I mean, the hospital has a number of problems, Timothy. In the letter of the Medical and Dental Association to the board, and some people are blaming the board, and of course some people, every blame is being placed everywhere. But we have to look at the reality of the situation. A board can only work with the budget it was given. The board can only work with the budget that is given. Secondly, you must have a coordination, the board and the clinical staff. The board must listen to heads of department. All right? You cannot operate as a board and you have clinical staff. You're not listening to what the clinical staff is saying. You must have a correlation of what the heads of surgery, heads of obstetrics, heads of internal medicine, emergency medicine, what they're telling you and what they need. Now, I can say St. Jude's Hospital and the board of St. Jude's, they're a perfect example of a coordination of the board and the clinical staff. Whichever government, you have seen that the board and the clinical staff have always worked together. But whether you had that kind of cooperation between the board and the clinical staff. Thirdly, every hospital must have a level of protocols and accreditation. All right? You cannot run a hospital if you don't have protocols. You must have protocols for the emergency room. You must have protocols for surgery. You must have protocols within the obstetrics and every department, every hospital in the world runs on protocols. And why do you have protocols and accreditation? Because you must have checks and balances. And it is very important that you have that, because when you miss out, Timothy, and you miss out certain things, it can cost the patient their lives. You understand me? So if you do not have protocols in the emergency room, you know how many patients would go through the cracks and end up dead. You would end up misdiagnosing patients. Patients who may need immediate management and stabilization will not get it. So that is why you must have strict protocols within certain departments.
Let's
or
put
every department.
Let's put the telephone number on screen right now so that you can call with your questions and comments for my guest. Once again, medical practitioner Dr. Sylvia Wilson is my guest as we focus on health-related issues in St. Lucia, and in particular the operations of our two main health institutions, the St. Jude Hospital and the Millennium Heights Medical Complex. So the telephone number is on screen right now as we continue our conversation here. Women in politics. I recently saw you on a platform, on a particular program of the United Workers' Party. Are you looking to enter the political arena? Are you looking to contest elections in St. Lucia, contest a seat, so that possibly if you win, if your party wins, you become the health minister? You're saved by the phone right now, by the call. We have a call. Good evening to you, NewsMaker Live, you're on the air.
Good evening.
Hello, good evening to you, caller. Okay, what was that call? Mm-hmm.
Timothy, as a St. Lucian, and after so many years of working in the medical field, I recognize one particular thing, that we have to change things from the top.
Hold that point. Good evening to you, NewsMaker Live, you're on the air.
Yes, sir. Good evening.
Hi, good evening to you, caller.
Yeah, young man, honestly, my first experience, I actually had a situation a couple of days ago. This was a holiday on the Monday, and I had to go to the polyclinic for my son. He got the hand and foot and mouth thingy and disease. And I actually spent 5 hours at the polyclinic. 5 hours. And that, my brother, was a shocking experience. For the first time in my life, I enjoyed that. You understand what I'm telling you?
Yeah, we
I have
understand.
a son who's 3 years young.
Yeah, 3 years,
spent
okay.
5 hours at a polyclinic. I got no assistance. I had to leave. My son's doctor was unavailable when I called him in the morning. When I got him in the afternoon, he said, come to his house immediately. That was 5 hours later. Could you imagine? I went to the clinic at 11 o'clock in the morning. Somebody saw me about an hour later. I paid $20. I'm waiting. I left my child's mother there. She's getting pushed because the child is moaning, he's crying. I came back to the hospital, to the polyclinic. Spent a couple more hours. I left there after 5. When I called my private doctor, he said, well, he's back in town, so bring the child across to him. And my brother, for the first time in my life, I could tell you, I was appalled. I now understand what's really happening in this country. But anyway, good night.
Okay, thank you so much.
Yeah, Timothy, as I said, the pressure is on the emergency room of the main hospital, because Victoria Hospital is no longer open to the public, because some of the pressure would be taken off, would have been taken off the main hospital, and of course you'd see patients there. But we have people coming from Castries, and plus we have a very large population in the north, and we barely have a skeleton staff at the polyclinic who has to deal with everything.
Well, that point. Good evening to you, NewsMaker Live, you're on the air.
Good evening, Tim, and good evening, Dr. Sylvia Wilson.
Hi, good evening to you, caller.
Good evening.
Go ahead, caller.
Everything that Dr. Wilson said is so true. The healthcare situation in St. Lucia is in a mess. And while this government continues to pretend that there are no issues with our medical situation, the people of St. Lucia are suffering. It cannot be right that people have to wait 12 and 14 and 2 days at an emergency department seeking medical attention. Some people have, unfortunately, Tim and Dr. Sylvia Wilson, she knows that, died waiting to see a doctor. This cannot be right. And this Labour Party government must be, instead of protecting the victory, they have to protect the lives of St. Lucia, of St. Lucians. And it cannot be right for this government to continue to pretend that everything is okay when everything is not okay. Our healthcare situation is terrible. Who feels it knows it. And I'm happy that Dr. Sylvia Wilson is coming on your show tonight to be truthful, to be upfront with the St. Lucian people that, look here, as a medical practitioner, we have to do better as a country, and this Labour Party government must be serious and lead by example, govern the country instead of protecting the victory when people are dying on a daily basis because they lack the medical attention that they so deserve. Have a blessed night.
Thank you so much for calling. We have another call. Good evening. NewsMaker Live, you're on the air.
Hello, good evening, Tim. Good evening, Dr. Wilson. Dr. Wilson is always...
Good evening to you, caller.
Yes, good night. It's always a pleasure to listen to you, and it's like we are students in a medical school listening to you go step. And when I hear you speak about the different communities all over St. Lucia, it tells us this is someone who knows so much about our healthcare. And it is sad that the St. Louis Labour Party, they never cared. Check history. They never care about our healthcare. See who they put in charge. Once they put, I believe it's minister once, then they put Alvina, who was more like a minister of churches. She knew nothing about healthcare. Now they have Musa, who is like a minister of Trump. Right? They don't even care about our healthcare. And the St. Lucia Labour Party, what I realize, they don't care about healthcare. They are preparing for next year carnival already. They inject so much money into carnival, jazz, and they don't care. Imagine someone died today because of a bellyache at a hospital. It tells you, just watch, there is a child who got shot, a 10-year-old got shot, and they are asking money to bring this child into service. This is a shame on the St. Lucia Labour Party. You know, this child should be taken care of. I am calling the St. Lucia Labour Party and Minister of Health and the Prime Minister to take care of this 10-year-old. Dr. Sylvia, I hope when Alan Shastney win this election, they will make you our Minister of Health because you do your work. Good night.
Okay, thank you so much for calling. Another call online. Good evening to you. NewsMaker Live, you're on the air.
Good evening, Timothy.
Hi, good evening to you, ma'am.
Timothy, I just wanted to say that everything that is happening in our healthcare system at this point in time was said by Alan Shastney when he was Prime Minister. And I'm going to just take maybe just a minute to give you the backdrop as to why I am making this statement. When we came into office, we found OKEU Hospital closed. I want St. Lucians to remember that the then Labour Party government had a ceremony. They named the hospital and they closed the hospital. When we came into office and we found that and we did our checks and balances, we recognized a lot of the equipment in there was either outdated, some of them were damaged because the place did not have air conditioning, they were not in a cool room, all kinds of problems. But one of the most critical things that Alan Shastney saw or recognized was that, one, in order to operate this hospital, this new modern hospital, we would need a lot more money than we currently are allocating in the budget. And so the first thing he said was, why don't we institute a measurement that would allow for the hospital to have sufficient money, hence the reason for the National Health Insurance. And so if the hospital can have money and can operate like Dr. Wilson spoke about tonight. Budget. Budget is very important. You cannot budget healthcare team. You cannot budget that 10 people will get sick for the year, 5 people will need surgeries, 20 people will need this and that. You can't budget that. And so you have to ensure that there is a system that has money that can pay for that. That's number one. And number two, Dr. Wilson mentioned something that is also very important, protocol. What we recognized as a government when we did our walkthrough, especially at VH at the time, we recognized that protocols that they were using were not updated up to, 2020 and 2021 levels. And because we had the experience of Cayman Health City, Prime Minister Alan Chasney at the time said, if we are going to move into this new hospital, why don't we train our doctors, our nurses, our persons in operation with updated and new modern protocols, so that when we go into the new facility, we don't go with the old ways and the old habits of doing things, but you go into a new facility with new ways, new habits of doing things. Hence the reason we contracted Cayman Health City consultants to come down to teach, to train, and to prepare us for the transition to the OKEU. And so, Timothy, when this Labour Party administration, we were forced to open, unfortunately, because COVID came and we had no choice but to open the facility. But when the Labour Party came, they found Cayman Health City there. And I can certainly tell you, team, the protocols and the services that Cayman Health City had put in place and recommended, they are there, sitting on a shelf, gathering just like every other report that government has paid for. And today we are paying for it with the mess that is happening in healthcare. And so for me tonight, it is so very sad listening to Dr. Wilson, listening to what our doctors, our nurses have to go through, but equally so listening to what our patients, our St. Lucian people have to go through just because of the stubbornness and the politicization of our hospitals. You see, just like people say, Tim, we should not politicize crime, healthcare is one that is equally more important that we shouldn't and cannot politicize. And so when you put square pegs in round holes, when you put politics before the health of people, this is what is going to happen, and this is what Dr. Wilson is talking about. Thank you very much.
Okay, thank you so much for calling. I think we already have another call on line. Hold on, Doc. Yes. Good evening to you. NewsMaker Live, you're on the air.
Yeah, let me just see something.
Hi, good night.
Hold on. Go ahead, caller. Go ahead, caller.
Okay, well, it's very sad to know that we are faced with such issue in St. Lucia, because I experienced that sometime last week. I went to the polyclinic to see a doctor. After going through triage, she told me I had a 4 to 6 hour wait. While I was waiting, I realized there were also a baby had to go through the same process. So I understand when everybody complains how serious this thing is, because I had to face it myself. And I realized nothing is happening. No one is trying to say, here are the solutions that can be implemented to make healthcare better. While I understand it has to start at the end, to get to filter it down to the doctors, so then the doctors could then give us quality healthcare. But if there is a problem, there's no way that we could get a solution. And while I realize also that the government of the day is not prioritizing the business. We have healthcare, we have networks, and we also have school and education. While everyone has to spend and find money to run the different departments, at the end of the day, nothing much is happening when it comes to the healthcare section, and the priority is not there. So right now, we all are being faced. Right now, if you know you're sick and you go to the polyclinic or you go to the OKEU, just know for a fact you have to wait 8 to 12 hours before you see a doctor. And it's a fact. Sometimes you leave, you don't even get the treatment. You have to wait the following day to go to a private doctor. And it is really sad. And too many of us are suffering from this situation. And we need an immediate solution to this problem, because healthcare should be priority number one before anything else. And we need to take action against it.
Okay, ma'am.
That's my point for tonight. Thank you
so much.
Can I make a few points?
Yes, go ahead, Doc. Go ahead.
Listen, Timothy, I agree with the callers. and I feel the pain of our patients, because listen, many times our patients tell me, Doc, you know, I'm going through this, and even at the, sometimes in the middle of the night I get calls, and I have faced it in my own family when I went with my brother, and what my brother faced as a physician and the care that he got. You understand me? And I went through it. It was like a horror movie. All right? It was like a horror movie. And I was prepared to charter a flight and take my brother over to Martinique. All right? So I know personally what it is not having the services, and even being a physician and having an emergency and having to face certain things and not getting the necessary. So any one of us can be faced with it. So I understand perfectly well what our patients are going through, because I went through a horror story with my brother. All right? So St. Lucians, I know we need to demand a better. We need St. Jude's up and running. We need to upgrade Grosile Polyclinic. You see, Grosile Polyclinic no longer serves the needs of the growing population that is there. You understand me? We need to upgrade that. And as I said, initially it was supposed to have been a trauma center, but right now we need more services with the Grosile Polyclinic. And something needs to be done with Victoria Hospital and our other services. So, Timothy, there is so much to talk about, and I understand what our people are facing, but we need to talk about financing. And St. Lucians have taken the have given 2.5% for healthcare. And for years, St. Lucians are prepared, you know. St. Lucians are prepared to sacrifice a tax so that they can get better health care. Because look, we have now the 2.5%. St. Lucians got taxes on petrol, on gas. And what about the taxes there that we can put into healthcare? What about the CIP funds? Can we not invest? So healthcare is very important, and we've seen, because of through just a situation of COVID, how COVID could have locked down our country, locked down our economic system, locked down the tourism sector, locked down everything. If we do not have healthcare, we do not have productive individuals, and we cannot talk about a moving economy.
You have a call. Good evening, NewsMaker Live, you're on the air.
Good evening, Timothy.
Hi, good evening to you, caller.
Good evening, Dr. Wilson.
Good evening.
Somebody called me and said, okay, listen to the show, Dr. Wilson is there. And when I heard Dr. Wilson speak, it really touched my gut, and I'll tell you why. When I was ready to give birth with my first son, you were talking about C-section. So I went to Tapio Hospital, my doctor, Dr. Bennett, and my pediatrician for the kids.
Yeah, Dr. Bennett
Dr.
is
Simmons.
dead now. Yeah.
And you make such a valid point. Had I not had the money or the insurance to be at Tapio Hospital, and my son is in distress because I can't give birth naturally, what would have happened to him? That's really, really touched me, because
He would be
we
dead.
cannot have people losing their children because they do not have the finances, or because the hospital is not equipped with the relevant doctors in order to take care of them. And you were mentioning different specialties of doctors we need in the emergency room. Now, this is very critical. It really touched my soul. I am not looking at this medical care issue from a political standpoint, but I'm looking at it as an individual. Because, listen, it is affecting all of us, irrespective of your political affiliation. And you saying that, Dr. Wilson, it really made me think. We need to sit down as citizens, as leaders, and really start doing something about the healthcare. Because if this is not done, we will be in serious trouble. But your point about C-section, you need a doctor, it really brought me back 26 years ago, because my son is 26 years old. Both of my children were born at Tapio. Thank God to Tapio, but not everybody can go to Tapio. Thanks for your contribution.
Exactly.
Thank you, ma'am.
Exactly, Timothy. What about the people who cannot go to Tapio? And if you have your baby in distress, and do you what do you do? You don't have an obstetrician on duty? You cannot go into a cesarean section. You have to watch your baby die after 9 months of carrying your baby. And what traumatic effect it has on the mother, the husband, the family. No, that is a very serious thing. That is very serious, because that is your life and the lives of your family. So you cannot say that happens all the time.
We have a call. Good evening to you, NewsMaker Live. You're on the air.
Hi.
Good
night
evening.
to you again.
Good evening to you, caller.
I'm calling with a suggestion. I am not sure if that's going to even, I'm not sure, but I'm going to say, like, for instance, we have the Babuno Wellness Center, and I remember back in the days, I think there was some discussion of having this Babuno Wellness Center to run for longer hours. Mm-hmm. I believe that all of these structures we have sitting here only for 8 hours functioning, and the rest of the hours they're closed. How about the government of the day? Look into the Babuno Wellness Center, look into, like what Ms. Wilson was saying, the ones in town, make it go on a lengthier period so it could help ease off the burden of the major hospitals. But those hospitals, like wellness centers, are just there for 8 hours maximum. This structure, you have lights on all night long, nothing is happening. Why are we paying electricity bills for a structure that is just there? We could at least have 2 doctors right there in Babuno that could at least assist with the wide community of Babuno, which has more than 14 constituent communities or whatever you call. At the end of the day, these people don't take time to get a solution to problems, and they want to give priority to everything that does not make sense. So they need to look into those structures and put functioning things in there that at least we could say, okay, something happened before 12, you could go to the Babuno Wellness Center, or you could go to Lage Community Center, or something, and get, like, healthcare. So this is something they could really look into, and to see how it can alleviate the stress in the other major centers.
Thank you, ma'am. Thank you so much for calling.
Can I make a point?
Yes, go ahead.
Timothy, in 2010, after the fire in St. Jude's, I was sent to Japan, all right, the JICA, and for emergency medicine. And the Japanese have what you call afternoon hospitals, all right? So you have a doctor, pediatrician, surgeon, obstetrician that would happen, and that would operate in, evening time going up to the night time. We have certain centers that are underutilized, like you see the Babuno area. The lady is correct, that could extend up till midnight to take off the pressure of the polyclinic. But the thing comes with resources. You need nurses to man it. You need nurses. And you cannot have a community hospital if you don't have a midwife. All right? So you need midwives. You need skilled individuals to continue operating under that. And it's not only Babuno area that we can utilize the existing structures. But what about the south of the island?
Hold on point. We have a call. Good evening.
Good evening, team.
Hi, good evening to you.
Good evening.
Good evening to you, caller.
I have 2 points. One, if without question that our healthcare is in utter shambles, and the people who are tasked with fixing it, if they are not affected by it directly, because as it has been proven to us, when like the doctor was saying, everybody gets sick. Yes, that is true. Everybody gets sick. Even though you eat healthy, you could have an accident. But the people who are tasked with fixing our broken system, they are not impacted by that broken system, as they have proven to us. When any of them end up in a situation where they need health care, they just step out and go where they can get it. You understand? What incentive is there for them to fix it? Because, I mean, it is proof that, yes, it is going without, it's just getting worse and worse and worse. You understand? I am so sure if they did not have that option to leave and get it done elsewhere, when it comes to their personal well-being, something would have been done about it. Even though it was one health center or polyclinic they fixed, so they know, well, at least they can go there. Because one of the greatest things about humans is self-preservation. Okay? People can try and make as much money as they want, but with all that money, if you get sick, you will not be able to heal yourself. So they know they're making their money. They know if they get sick, they can use that money and go and get care elsewhere. And that is just the main thing, as I can see, because I'm a logical person. And for me, that makes sense. And that is what it's making. It's playing right on our eyes. When they get sick, they get out. And again, you might say, well, they're not always going to be in government. What happens when they're not in government? Guess what? They're bread butter already. Counts are set. After they leave government, you think they're going to be going to Victoria and OKEU and St. Jude? No, the accounts will still allow them to fly out. And the other point, you realize our government is involved in embezzlement.
What do you mean by that?
Embezzlement is the using of funds that someone is interested with, for use in other purposes. Because right now we were told that they were collecting a 2.5 for health and safety.
And security.
And like the doctor just said, the health budget is cut. Understand? All our health institutions are deteriorating. And we're definitely not feeling any safer in this country. So how can you tell me you're collecting millions of dollars for two sectors, and both of these sectors are going down the drain? Either you're not spending the money on those sectors, or you are doing such an atrocious job with it that it's not just not improving, it's getting worse. So until they can come and show us what are they doing with that money to improve these sectors, obviously it's not improving, so they cannot show us what they're doing. Until they can actually show us what they're doing with the money, I have to say the government is embezzling these funds. Understand? But again, we have no accountability in it.
Okay, caller.
Thank you.
Thank you so much. This is NewsMaker Live. We continue with your calls.
Timothy, let me make a point. Health care and the life of any individual has no political color. As St. Lucians, we need to make sure our families are safe. Our children can take, if our children are sick, that we can go to a place that we get the care. That your grandparents are sick, that they can go to a place that they can get the care. That your wife has cancer, that she can be cared for. And that is within our country. Okay? According to Bob Marley, how many times we have to suffer? How long we have to die? We have to continue to die. And that we have to take. We have to take responsibility, whether it's a politician, to do the responsibility of what you are being elected to do. And that is for all St. Lucians. When you are the government of St. Lucia, you are the government for everybody. Whether you are yellow, blue, green, or everything, but for St. Lucians. But I think at this point in time, we have to look at our healthcare seriously and what our people are being faced and whether they are getting quality, and we need that care within our country. Why we have to run out of our country for everything? Run out of our country for kidney treatment, run out of our country for cancer treatment, run out of our country for head injury, run out of our country for all of these kinds of things. This is our country. And whether you're a politician, a professional, a farmer, or so on, we need to have the services to take care of ourselves. And that is why I think St. Lucia should demand better.
We have a call. Good evening to you. This is NewsMaker Live. You're on the air.
Good evening, Timothy and Dr. Wilson.
Good evening to you, caller.
The previous caller was so right, because my rep, Joachim Henry, is ill. And where did he go for the services? In France. Virginia Poyot, who fell sick, where did she go? Martinique. So they don't really care about us down here and the services that they provide to us, because they know when they fall sick, they fly out. Good night, Timothy.
Yes, good evening to you, ma'am. Some more of your calls. We'll take at least 2 more calls, and then you'll have the final comments. Dr. Wilson. Good evening, NewsMaker Live, you're on the air.
Right.
Hello, good evening.
Yeah, good evening to you and the doctor.
Good evening to you, caller.
I want to tell the doctor something. If you as a doctor, you're concerned about the people and the people of the country. So why did you start that campaign on a platform, WP platform, campaigning about healthcare?
Caller, what does it have to do with the situation at OKEU and Century?
Let me answer.
Go ahead, Doc.
Every St. Lucian has a right to their religious affiliation, their political affiliation, their doctor, their priest. All right? I could have chosen anybody that I want to pick. You have a right as a St. Lucian to choose, because this is a democracy. You understand me? This is a democracy. And as a physician or any politician should, if you're in government, you should serve all St. Lucians. But since we are the democracy, we must have 2 parties, or we must have political parties, so people can choose who they think the policies are better. All right? So I think I have a democratic right, according to my constitution of my country, to affiliate with anybody that I think has a policy. But as a St. Lucian, I know what I want for my country, and I want healthcare. The same way like the caller, he could be Baptist, 7 days, whatever. It is his choice. He could be SLP if he wants. When he wants to change SLP, he can be UWP. It is his rights.
And it's also the right of politicians. Yes, exactly. One day to be UWP and then to jump ship and go into SLP and vice versa.
And let me tell you something. I was raised in Miku. I am from the community of Miku. And I have my affiliations to Miku. My parents, my grandparents, everybody from Miku. So I would like to serve my community. And that is clear. Anybody who knows the Wilson family, we are from the heart of Miku. All right? So I think I have a democratic right, like every St. Lucian.
Final call. Good evening, NewsMaker Live, you're on the air.
Good evening, Tim.
Yes, good evening to you. Quick contribution.
Good evening.
And good evening to your guest.
Yes, good evening to you, caller.
Okay, Tim, it is a noted fact, and the doctor knows that most doctors in St. Lucia, the overwhelming majority of doctors in St. Lucia were trained in Cuba. You know that, right?
Yeah, caller, we're listening to you. Make your point, please.
Yes, right. And also, it's a noted fact that the OKEU hospital was commissioned by the Labour Party government while they were in office. And then people are calling the show and saying that the Labour Party has done nothing for healthcare in St. Lucia. There are doctors who did not have the opportunity to study medicine. They got opportunity to do so free of charge because of the diplomatic relations that the Labour Party established with Cuba. And right now, we are benefiting from that, and there are many people that are benefiting from that as well. But
and what's the point?
Are you still there, Shazi? I think they've lost him.
Timothy, St. Lucians have been trained in Cuba, Taiwan, University of the West Indies, England, everywhere. When you come back, you are St. Lucian, and you have to serve St. Lucia. All right? Now, we must stop saying, oh, it's the government of St. Lucia. When after an election, you become the government of St. Lucia, you have to serve SLP, UWP, NOPI, independent, everybody. Healthcare. Healthcare is something that every St. Lucian should be thankful for. Now, the fact is, every St. Lucian, nobody was given anything on a platter. Any doctor or any professional you see in St. Lucia never went into a university and you were handed a degree. You understand me? You had to study hard. You had to study for many years. Nobody, no political party will tell you, look for your degree. All right? Now, not only Cuba have I gone to, but I've gone to Israel. I've gone to Japan. All right? I've studied in Israel, in Kafasaba. I've been in Osaka in Japan. So I've worked in Jamaica. I've worked in St. Martin. I have worked in Kafasaba in Israel. I have been in Osaka. So I have been, and I was never handed anything on a platter. All right? I had to work hard for it. So Shazi, I don't know who gives and think anybody receives anything on a platter. Every student, when they go out, whether it is Cuba or Taiwan or University of the West Indies, got to work hard.
Final comments, Doc, and let's address the issue of women in politics and whether you intend to contest the next general election. Go ahead, ma'am.
Timothy, I've always loved politics and medicine. My passion has been sports, but then I realized at that particular time, the opportunities you were not available to continue sports. I was a victorious loader at the Vifford Comprehensive School in my Form 4 and Form 5. But I never got the opportunity to do any, to get scholarships to it. So I love sports and all kinds of sports. So, and that's my passion. Also, medicine is my passion. And my passion is politics. I have followed many politicians. You understand me? When I was at A level, I used to stand in the Constitution Park to listen to George Odlum. All right? I can tell you from all of these times. All right? Follow Mandela, follow Michael Manley, follow many, you understand me? I have been very passionate about politics. Now, I feel for things to change, you need to have change at the level of policy. And I think many women in St. Lucia should go into politics. All right? So that we can have fundamental changes, not only in security, but in healthcare. All right? In housing, the quality of housing that we have. And as you know, in St. Lucia, women have been the bedrock in many communities. You understand? And also women have been the support in many political parties in St. Lucia. So we support whether it is UWP or SLP, and we are not at the forefront. So I would, I would like to see that many women get involved in politics. And I think women are very serious when it comes to taking certain issues. All right? Whether it be in security, whether it be in healthcare, whether it be in so on. Because sometimes it impacts the family and we feel it and we know what to do. All right? So I would ask our St. Lucian women to participate. All right? Participate and get changes done. All right? At the level of at a level of policy and government. So that's one of my interests. You understand me? And my interest, and I'm strongly and I'm passionate about seeing that we get a change. I have dreamt of we having our hospitals where we have helipads, where we have intensive care and mobile units, where we have trauma center. That is my dream, and to see that our people can't get that kind of thing until maybe when I'm at 80 or something, that if I am suffering with cancer, I can go to a cancer center right here in St. Lucia. You understand me? And that my grandchildren, only one daughter I have, but I could be taken care of right here in my country. So I have that dream, and I think, you know, most of us should dream of having our country, having the best in our country.
Thank you so much, Dr. Sylvia Wilson, for being my guest on this evening's NewsMaker Live.
Yeah, thank you ever so much.
Welcome, ma'am.
You're most welcome.
And to you, thank you so much for taking the time to watch the broadcast, to listen, and of course to contribute via your calls and of course your discussions in the chat room on the DBS website. If it's Wednesday, it's NewsMaker Live. Time now for the clip that peaked.
Hang on a sec. Excuse me. Hi. Where's my chips? They're on your plate. They're not. What? Oh my God.
And as a broadcast, my name is Timothy Poleon saying good night and see you next time.
I, Philip Joseph here.
I would like to be judged as being the Prime Minister, not being judged as being part of a government.
Came into government that we had a manifesto and a vision and mission that had been approved by my party, by the highest body.
Basel 11 has not been in existence. 50 was...
Giant getting bazooka. You spraying big on to knock out mosquitoes.
I have never had a joint account with anybody in my life. Not my ex-wife, not my children, nobody. And I will refer that to the privileges committee.
What about the culture of people getting into office and not being effective? What people become Prime Minister of St. Lucia have been the most ready.
Let's do it this Wednesday, because if it's Wednesday, it's NewsMaker Live.